Hi, my name is Ashley.
And my name is Heather.
We are going to demonstrate the correct and incorrect ways to deal with this scenario.
The scenario we are dealing with is a nurse is standing at a nursing station on a medical surgical floor at an acute care hospital. The nurse is reviewing a patient's chart when a surgeon comes up to her and says, "Honey, I'm in a rush and I need your chart right away." The nurse is flustered and angry because she has not finished reviewing the charts. What should she do?
Here are the three scenarios.
Yeah, I did read that. I thought the power of force would really help us out here at the hospital.
What book is that?
Oh, it's Peace and Power. Have you read it?
Yeah, I did read that. That'd be great for us to all read.
Yeah, I was thinking
And the
that too
doctors
after I
also.
read it. Yeah, I think that'd be really beneficial to our hospital.
To improve our communication between us and the doctors.
We really do need that. I agree. Oh, I have to get back to this chart though.
Okay, yeah, I gotta finish my patients. Hi, Dr. Bailey, how are you?
Really busy. Honey, can I use that chart?
I'm clearly in the middle of working on this still.
I'm sorry, but I'm really in a rush.
You're not the only one with a hard job and a million things to do.
Well, I need to get this completed. Maybe if you worked a little bit faster?
Excuse me, but unlike you doctors, us nurses actually take our time and care about our patients, and we do this by thoroughly going through the chart and listening to what they actually say instead of just signing off on some chart without a care in the world.
I signed it, I finished it, I completed it because I'm the physician and that's who's important in this matter.
Fine, and by the way, I'm not your honey. This first scenario was the incorrect way of handling the situation. First, the nurse should have maintained her composure and should be more considerate that everyone else is busy as well in the hospital. Everyone should be respectful towards each other, meaning the doctor should not be calling the nurse honey, and the nurse should calmly express her concerns. Her body language was also inappropriate because she refused eye contact with the doctor, kept her hand on her hip, and also was continually rolling her eyes at the doctor. Also, if patients witness the nurse's actions, it is not a good example to be setting for the hospital. They are our patients and are in a vulnerable setting and should not witness such actions. This could also jeopardize the fiduciary relationship between the nurse and the patient, and the doctor had also crossed the professional boundaries by calling the nurse honey.
Yeah, I did read that. I thought the power of force would really help us out here at the hospital.
What book is that?
Oh, it's Peace and Power. Have you read it?
Yeah, I did read that. That'd be great for us to all read.
Yeah, I was thinking
And the
that too
doctors
after
also.
I read it. Yeah, I think that'd be really beneficial to our hospital.
To improve our communication between us and the doctors.
We really do need that. I agree. Oh, I have to get back to this chart though.
Okay, yeah, I gotta finish my patients. Hey, Dr. Bailey.
Hey,
How are you today?
I'm really busy. Honey, I'm in a rush. Can I use that chart?
Well, but
Right away.
I thought you weren't even done filling that out.
I wasn't though. I still had a lot of stuff to review and it was kind of sloppy.
Why didn't you tell him?
I don't know. He just asked me for it and he took it. I didn't say anything.
Well, maybe next time you should just calmly talk to him and say that you were still working on it.
Yeah, I know. He's the doctor, you know.
I know, they're all like that, but we all need to practice better communication. That's why that book would be so good if we all had everyone read that.
Yeah, maybe you're right.
The second scenario was not handled well either. By handing a doctor an incomplete chart, a nurse may be unconsciously putting a patient in danger. Wrong or inappropriate medication or treatment may be given, failing to uphold patient autonomy. Lack of communication from a nurse is unacceptable because our first priority is patients and their well-being. We as nurses need to portray a role that is assertive and commanding while also realizing not to cross into others' territory and respecting everyone's thoughts. Effective communication with colleagues is essential to working well with others and protecting patient safety.
Yeah, I did read that. I thought the power of force would really help us out here at the hospital.
What book is that?
Oh, it's Peace and Power. Have you read it?
Yeah, I did read that. That'd be great for us to all read.
Yeah, I was
And
thinking
the
that too
doctors
after I
also.
read it. Yeah, I think that'd be really beneficial to our hospital.
To improve our communication between us and the doctors.
We really do need that. I agree. Oh, I have to get back to this chart though.
Okay. Yeah, I gotta finish my patients. Hey, Dr. Bailey, how are you today?
I'm really busy. Honey, I'm in a rush. Can I use that chart?
Well, I understand you're in a rush, however, I'm not quite done this chart yet.
I expect you to have that done.
I completely understand. I just need to finish up, and I'll immediately give it to you so you can finish your work up also.
Thank you. I really appreciate it.
And also, while we're discussing it, I'd like to tell you that it makes me uncomfortable when you call me honey, especially because I don't know you that well. I know you mean well, but it comes out as degrading and rude to me sometimes. I would really appreciate it if you called me by my name.
I'm sorry. I didn't think I was being rude. But now that you said it, I realize I was crossing professional boundaries. It won't happen again, Miss Nurse.
Thank you so much for understanding. I'm going to go finish up, and I'll call you over shortly so we can go over this together and we can finish up your work.
All right, sounds great.
All right, thank you.
This last scenario was the correct and effective way of handling the situation. The nurse successfully exerted her presence in a calm manner and nicely asked the doctor to wait until she is done completing the chart before he can obtain it. The doctor respectfully accepts the nurse's request to wait until the chart is finished. The nurse uses restatement as well as empathy to communicate her needs to the doctor. The nurse also stands up for herself and genuinely asks the doctor to refer to her as her real name as opposed to referring to her as honey. They both use active listening and communicating with each other, and it's a very effective way.
In closing, we would like to enforce that good communication and listening skills with your patients and your colleagues is one of the most essential skills to learn as an aspiring nurse. Be respectful to others, but also defend your thoughts and clients and collaboratively find the best solution. Thank you for taking the time to watch our video, and we hope it is helpful to all future nurses. This video's cast was made up of sophomore nursing students at the University of New Hampshire. I'm Jill.
And I'm Ashley. I play doctor.
I'm Danielle. I'm Sarah.
I'm Ashley.
I'm Kaylee.
I'm Heather.
And I'm Michaela. I played the nurse, and I hope you all learned from my mistakes as well as what I did correctly.
Thank you for watching.